So one of the most frequently asked questions we get about Celluma is, why did we design it to be a flexible shape-taking device? That is a great question. So not only is it flexible and shape-taking, but Celluma is unique in that it can be molded to the area and it will keep its shape without any stands. So you don't need anything to hold it in place. Once you place it, it will stay in place, whether you're placing it over the face, over any of the body joints, over the tummy, or over the face, neck, and décolleté, which we will demonstrate further on in this presentation. So while that's very important, the ability to place it really close to the tissue is also really important. And this is based on the inverse square law, which is a law of optical physics that states that as you double the distance of your light source from the surface of absorption, meaning the skin, the ability of the cells in the tissue to absorb the energy is decreased by 4 times. And every time you double that distance, it's another 4 times less energy being absorbed by the cells. So why is that important? Well, it's important because when it comes to light therapy, it's really much more about how much energy is absorbed than the amount of power being emitted by the device. If the cells cannot absorb the energy, then the power really is irrelevant. So designing a device that can be placed close to the tissue to enable maximum absorption of the energy is crucial to faster and better outcomes. So Celluma is actually a flat panel that allows you to conform it easily to any part of the body. For positioning either the Celluma Pro or the Celluma Skin over the face, you want to preform it into a C shape. And don't be afraid of your Celluma, it's very sturdy and durable. So you can do this with it all day long. This is a flexible device that's designed to be flexed and hold its shape. So this is the C shape. You can remember this by thinking C for Celluma. Then move over to your client and have your client raise the back of their head off the bed just about an inch, and then position it nicely like this. You can put your head down, and then, I like to position it that it's not touching the nose, but that it's really, really close. And this is an ideal position right here. While we always want to encourage closer positioning of your Celluma panel, we also want to keep your patient's or your client's comfort in mind. So if this position, for example, is too close, you can move it out a little bit, 1/4 of an inch or 1/2 inch on either side, just so it's still evenly placed, but your patients may be a little bit more comfortable. You can see the perfect contour and consistent distance from the skin. No other LED light therapy device can achieve this. So another tip for positioning either the Celluma Pro or the Celluma Skin in the face, neck, and décolleté position is to use a single Celluma facial rest. Now, I do want to emphasize at this point that you don't want to use the Celluma facial rest in any other position with either the Celluma Pro or the Celluma Skin, because they're already built into the device, and adding the extra length will be detrimental to your results. So they are very handy, however, for positioning over the face, neck, and décolleté. So here we have one Celluma facial rest directly behind the head. The corded end of the Celluma is in position, and we follow the vertically over the face, position it nice and closely to the neck, and down over the décolleté. So now we're going to demonstrate correct Celluma positioning for the smaller Celluma panels. Remember, the Celluma Pro, Skin, and Elite are already sized perfectly for over the face. The smaller panels, the Celluma Light, a 3-mode device, the Celluma Home and Face, both 2-mode devices, and the Celluma Clear, a 1-mode device, they do require a stand either side of the face in order to correctly position these smaller panels. And these stands are called facial rests, and they come with each device. So let's take a look at the positioning for these smaller Celluma panels, the Light, the Home, the Face, or the Clear, because they're all exactly the same size and the same dimensions. So if you take a look, you see that the pair of facial rests is placed either side of the head, and they are positioned squarely on the table. This leaves the whole panel very, very secure. And then they just slip into the little slots either side. I have this device, this is the Celluma Light, turned on in the anti-aging program. and which will run, of course, for 30 minutes until it's finished, less if you desire. One little tip for using these size panels is that occasionally, depending on the size of the head or the comfort level for the patient, you might want to place the head on some folded towels. This is nice and comfortable, but the benefit here is that we're getting that face and the skin closer to the diodes so that we can maximize the cell's ability to absorb that wonderful light energy. So if you're using your Celluma device to treat pain, particularly back pain, positioning is very, very easy. You simply take your device, turned on in the pain program, which is the near infrared dominant program, and you place it, if somebody has lower back pain, just place it directly over their lower back like this. And then if they have, if you want to run the Celluma down the length of the spine, Celluma is great in that it's flexible, so you can just follow the curvature of the spine and place it like this. The treatment area from end to end is 15 inches, so it covers a lot of the spine area. You can curve it right in against the lower spine like that. Of course, as always, you place it underneath the clothing so it's on clean, dry, bare skin. And as a reminder, you can treat a lot of pain positions in a sitting position. So instead of taking up a room, you can have somebody in a chair, and again, always place it on directly on their skin, but you can do a lot of pain positions in a chair. So treating pain with your Celluma panel is very easy. You can place it very readily over almost any joint or any part of the body, and it will stay in place because it's shapeable and moldable and will stay in the position that you place it. That means it's a hands-free modality, which is also very convenient and efficient. So here we're going to use the Celluma Light. We like to use the smaller Celluma panels, preferably, although you can use any size panel over any joint. The smaller panels will fit a little more snugly, and of course we understand that the closer your light device is placed to the area of treatment, the better and faster the results. So in this case, we've taken the Celluma Light. This is a 3-mode panel, and I have it turned on in the pain program, and we're going to demonstrate it placed over the shoulder complex. Now, the ideal way, and a great little tip for placing it over the shoulder complex, is to make it into almost like a taco shape, and this really positions it very nicely and very easily over the shoulder area. So if you're using any of your Celluma panels, I'm using the Celluma Light right now to treat any pain conditions. The protocols and the process are pretty much the same for every joint. So I like to preform it into a circular or almost a tube shape, and then place it over the elbow and form it, and it pretty much stays in place for the duration of the treatment. You can move it down to treat the wrist. The wrist is a smaller joint, so you can wrap it a little tighter around that area to treat the wrist. If you want to treat hands, you can actually treat both at the same time. So this device is turned on right now in the pain program, so you might be treating arthritic hands, so you just place it like this and leave it on there for up to 30 minutes. If you wanted to do anti-aging for the hands, you would just switch it to the anti-aging mode and leave it in exactly the same position. So we are frequently asked about the best position for treating feet, which is actually very, very easy. There are several ways to treat the feet, but our favorite position is to place the device on the ground beneath the patient's feet while the patient is in a sitting position. Again, this way you don't have to take up a whole treatment room, and as long as the patient doesn't stand on it or place heavy weight on the device, this will not harm your device in any way. So the patient will just gently rest their feet directly on the device.